It's that time of year, flu season, and what can you do to protect yourself? We're going to talk about that and more coming right up. Hello Kidney Warriors, James here with Dadvice TV, your online kidney health coach. And this is video number 56, helping you fight and beat chronic kidney disease. Kicking kidney disease's butt, woohoo! Awesome, and in this video we are going to talk about the flu. It is that time of year, the weather is getting colder, the trees are changing colors, the leaves are falling off all over the place, and people are coughing, people are sneezing. Germs are spreading everywhere and the flu is out there and we want to protect ourselves from the flu. Now nobody wants to catch the flu, but those of us with kidney disease or those of us that have a kidney transplant, we definitely don't want to catch the flu. So we're going to talk about what you can do to better protect yourself and hopefully this year, don't even catch the flu. But before we get into that, if you have not done so already, please take a moment and click that subscribe button and hit the little bell icon next to it. That way, every time I create a new video, when I have more information to help you fight and beat chronic kidney disease, you'll get a notification and be one of the first to see this content here on YouTube. Now, let's jump right into today's topic. How do you prevent and protect yourself against the flu? All right, the very first thing you can do to protect yourself against the flu is with a flu shot. And doctors overwhelmingly agree, if you have chronic kidney disease, you should get a flu shot. Now, there are some exceptions. If you are about to get a transplant or you just got a transplant within the last 6 months, consult your doctor, make sure it's safe enough for you to get a flu shot right now. Now, also, when it comes to flu shots, there's kind of 3 types. There's the nasal one, and if you have chronic kidney disease, stage 3, 4, 5. If you're on dialysis, doctors typically do not recommend the nasal spray because that's a live version of the virus. It's weak, but it's alive. You could get sick. So, yeah, I don't think anyone should probably take the nasal version, but I'm not a doctor. You can ask your doctor if you can take that. If for some reason you have chronic kidney disease and you're giving blood all the time, but you still don't like needles, I guess none of us really do no matter what, but I've gotten used to them. But if you prefer the nasal one, check with your doctor first. Now, the other types, there's 2 of them, are with a needle. And that's where most people end up getting them. Now, there's a tri version and a quad version. The tri version protects you against 3 different strains of the flu virus. The quad protects you what? 4 different versions. You probably want to look for that quad version just to be on the safer side and protect yourself. Now, it doesn't stop there. There's one more thing you got to check out for when it comes to getting that shot. Okay, so we're going to get our flu shot. It's going to be a shot. It's not going to be a nasal. It's going to be the quad version. We also want one that is preservative free. What? Preservatives in a flu shot? Yeah. I don't know why. Doctors typically don't talk about that. But if you have a good doctor, like my amazing primary care physician, he remembers, hey, kidney disease, no preservatives in your flu shot. Good news is, here in the United States, this year, 2019, approximately 85% of the flu shots given by injection here in the US are preservative free. Awesome, makes it easy to find them. So before you run down to your Walgreens, before you run down to whatever place you're going to go to get your flu shot, give them a call. Let them know, hey, I have chronic kidney disease. I'm looking for the quad version of the flu shot and it needs to be preservative free. Is that the one that you guys have? They say yes, make your appointment, go down there and get your flu shot and protect yourself. The next thing you need to do to protect yourself is don't touch the Tzone. As a matter of fact, my primary care physician is the one who created this, the Tzone. He has lots of material out there to help kids. He goes to schools and teaches children not to touch your Tzone. That is your eyes, your nose, and your mouth. It forms a T. Don't be touching that. That's a primary way that germs get into you. You touch something, they're all over your finger, you rub your eyes, you rub your nose, touch your lips, boom! Germs getting inside you, you can get sick. By not touching your Tzone, you're going to greatly reduce the possibility of you catching something, all right? Number 3, you better be washing your hands often before you eat every single time. And this is all year round. We've got kidney disease. We don't need anything else to fight. We're busy enough with that, okay? That keeps us occupied. Always wash your hands before you eat anything. Even a snack. You maybe think, I just bought a little tiny thing of macadamia nuts. I'm just going to eat a few of them. Wash those hands. Don't be spreading germs, putting them on the food, then boom, throwing it into your T-zone. Not good, all right? So wash your hands often. Carry sanitizer with you. Use the sanitizer when you're out in public places. You're gonna go visit someone and you got a rental car for the weekend so you can pack the whole family and the dog into the car and not load yours up with hair. That steering wheel is filthy. Oh my goodness, there is research that shows steering wheels in cars are dirtier than toilet seats. Holy cow. Don't be touching that. You clean that. You get you some sanitizing wipes. You clean those steering wheels. You clean those shift knobs and all the touch points in a rental car before you get in there. And then don't be sitting there dry, putting your hands all over that dirty steering wheel, picking up germs, and then scratch your mouth. Oh, that's somebody else's gross germs you just put into you. You're gonna get sick. Don't do that. All right, we don't want to get sick. Number 4, protecting yourself from getting sick this flu season. Sick people need to be avoided, okay? You're gonna go visit grandma this weekend, but now she came down with something. Sorry, Grandma, can't visit you this weekend. I'll see you next weekend. And if you are the one that's sick, don't you dare be taking it into work. No, that's wrong to do to other people, getting them sick. Sick people need to be isolated. Stay at home. Don't be spreading the germs to other people. Don't have other people visiting. Get plenty of rest. You know, take a nap. Watch some Netflix. There's some awesome shows on there. Get some Amazon Prime. Great time to catch up on your binge watching. Drink plenty of fluids. All right? Let's not spread the germs. That's key to helping keep ourselves and the ones around us healthy. And number 5, to help protect yourself. If you do come down with a little something, you got a headache, you don't feel that well, be careful with the medications you take. If your doctor gave you some prescription medication to help you, make sure, verify you have the renal dose. That's where that medication, that dosage, it's more helpful than harmful, okay? And over-the-counter does not mean safe. FDA approved does not mean safe. Non-steroid anti-inflammatories, all those are FDA approved. That's Aleve, Advil, ibuprofen. That's what destroyed my kidneys. That's what can destroy your kidneys and wreak all sorts of havoc on it. All right, so you gotta be careful. No non-steroid anti-inflammatory drugs. If you need to, most doctors will agree that Tylenol is the preferred painkiller to take. And they'll say you can take up to 4,000 milligrams a day. Woo! That is a lot. I don't even want to go there. You know, I think that's a bit too much, but talk to your doctor before you take any medication, even if it is over the counter. People make the mistake. They say, hey, this says over the counter. It's safe. This says natural. It's safe. You know what else is natural? Cyanide. Is cyanide safe? No. Natural doesn't mean safe. FDA approved does not mean safe. Over the counter does not mean safe. Any drugs you're going to take, ask your doctor first, okay? And if you have high blood pressure, look for ones that say, they're approved for patients that have high blood pressure. Because a lot of these medications out there, they're gonna spike your blood pressure. Oh my goodness, that's not good for our kidneys. Remember, we're keeping our blood sugar under control, whether we're diabetic or not, and we are always, always, always keeping our blood pressure under control. All right, now I know that was a ton of stuff to go over really, really fast. So let me briefly, before I move on, quickly summarize everything up to this point. You're gonna get a flu shot. You're gonna get the injection, not the nasal version. You're gonna look for the quad version, protects against 4 different strands of the influenza virus. You're going to get the preservative-free version. 85% of them out there in the United States are preservative-free. Call, make sure. You're going to wash your hands often before you eat anything. You're going to use sanitizer when you're out and about and you're touching things. You're renting a car or borrowing a car from someone, you're gonna clean that steering wheel. Ugh, it's dirtier than a toilet. You're gonna clean that shifter knob. As a matter of fact, you're gonna go clean your car today because you just realized how dirty it was and you probably haven't cleaned it in a long, long time. Clean that steering wheel with sanitizing wipe, okay? Now you're also going to avoid people who are sick. If you are sick, you're going to avoid people. You're going to get plenty of rest. You're going to catch up on your Netflix. You're going to drink plenty of water. If you're going to take any medications, you got a headache, back pain, any of that stuff, verify it with your doctor. And no, Advil, ibuprofen, Aleve, none of those things. Those non-steroid anti-inflammatory drugs, no, 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 no. Just because it's over the counter, it is not safe. And if you have high blood pressure, you're going to make sure and look for a version that says it is safe for those with high blood pressure. Whew, I think we caught up with all of it so far. And one last thing, please help Dadvice TV grow by sharing this video with others who have chronic kidney disease. I'm not a doctor, I can't diagnose, I can't treat anything, but what I am is an actual kidney disease patient. Diagnosed chronic kidney disease stage 5 out of the blue when my kidneys failed, not doing too good, spent a week in the ICU, pretty much told I had no hope except dialysis. Oh, am I so lucky that that nephrologist was not up to date on treatment strategies, and she was so wrong. It has been almost a year and now I am healthier than I have been in well over 20 years. I've lost a lot of weight. I've got my energy back. I'm looking much better. I don't have those sunken in skeletal eyes looking like a cast member from The Walking Dead. It's me. I'm back to normal. All because of diet and lifestyle changes. And I would not have been able to do that without learning about them from somebody. Now, I have an outstanding primary care physician who 100% supports diet and lifestyle changes to help with so many issues that people face on a common basis. And he doesn't like prescribing pills. And if he does prescribe pills, there's always an exit plan. You're not going to be on the pills forever. That's what I loved about him when I chose him. And when I was diagnosed with chronic kidney disease, he stepped right up and said, I'm going to help you. Don't worry. I know the doctor told you a whole bunch of scary stuff. Don't worry. I can help you. And he has it all through diet and lifestyle changes. So I encourage you, share this information, continue to learn for yourself, because it is amazing what you can do with just, controlling the foods that you eat and the things that you drink, the medication that you take. Now, it's not going to work for everyone. It's not a guaranteed solution, but for most people, it can help. And I encourage you to take the step forward if you haven't done so already. Get committed to the diet. Just commit for a month, okay? Stick with it. It gets so easy, and the results, the way you feel, you get your life back. And I want everyone to have that. All right, thanks for watching, and I'll see you guys in the next video.